honor to be here in Seattle, a town that is already so engaged on these issues. It's always nice to be amongst friends, and so I was especially excited to get to share the film here tonight. I'm especially looking forward to a dialogue with this incredible group of panelists, each of whom I admire greatly, and also to hearing from all of you. For some of you, I may be familiar because of my career as a model. But today, I stand before you as a career woman, a mother, a student of public health, a documentary filmmaker, and an advocate for maternal health. My career path has been anything but what most would consider normal. I began modeling at the age of 14, and by 16, I was spending my full summer in Manhattan working with Vogue on a regular basis. For the next year or so, it became my mother's mission for me to return to get my diploma from high school. Luckily for me, I realized pretty quickly that just being a model wasn't going to be good enough for me. I received my first big exclusive contract with Calvin Klein at the age of 19, and only was required to give my services for about 20 days a year. And that restricted me from also working with anyone else. So at 19, when my sisters and school friends were all starting college, I began to self-evaluate and started to create a curriculum of my own. This included taking classes in just about everything, from writing to French, horseback riding, meditation, yoga. About 2 years later, I ended the exclusivity part of my contract and started working and traveling as a model again. And by now it was the early 90s and the start of what would become known as the supermodel era. I hope most of you don't even know what that is. It was an interesting couple of years, and I enjoyed most every minute of it, especially the travel part. But by the time I was 25, I was ready for a challenge and knew that I was ready to continue my education. I applied to NYU's Gallatin School that spring and started classes the following fall. But when I was about halfway through my undergraduate studies, my dad was diagnosed with stage 4 lung cancer. I spent the following 6 months commuting back and forth to California from New York to manage his treatment and care. I had been a smoker myself in my teens and into my early 20s, and watching my dad suffer as he did because he had been a lifelong smoker was the impetus of my interest in public health. I spent the next few years focusing on finishing school, practicing yoga, and dedicating much of my personal time advocating on smoking cessation and prevention. My advocacy work has always involved sharing my own story, in this case, as a smoker who fought hard to give up an addiction of her own, and as the daughter of someone who lost someone to a preventable disease. My father died 6 months after he was diagnosed in the summer of 1997. This was not my first link to public health, but certainly not my last. My mom was born in El Salvador, and I feel fortunate to have traveled there from an early age as a child to visit family and to travel the world more broadly as an adult for my career, to have gained a global perspective of the world. I've always been keenly aware of the distinctions between the developed and developing world and the disparities of basic human rights. In 2005, I was invited by the humanitarian organization CARE to travel with them to see the scope of the work they were doing to eradicate poverty. I was there to support my friends launch the One campaign and RED, the effort to help fund efforts to fight HIV and AIDS. And in my free time these days, I'm pursuing a master's degree in public health at Columbia University. But it took another deeply personal experience to put me here before you today. 7 years ago, after delivering my first child, Grace, that you saw before, I began to hemorrhage. My midwife and the obstetrician who backed her managed my complication almost immediately. But I knew enough how lucky I was in the months that followed the birth of my daughter. I began to consider what this complication could mean for women without access to pre- and postnatal care, let alone a hospital. I thought of the enormous hole I'd have left in my own family and the news my death might have made, all because maternal death seems like such a rarity in our world today. But it's not. And at the time, no one seemed to be talking about the women who die every year from pregnancy and childbirth-related causes. They're no less important to their family as I am to mine. In a family, the mother is critical. Every mother counts. I learned that hundreds of thousands of women around the world do not have access to the care I received, and they die. That's 1,000 women every day of every year, and almost all of these deaths are preventable. Pregnancy is a critical period in a woman's reproductive life. It may also be the only opportunity for her to be seen by a healthcare provider in her lifetime. Simply having a skilled birth attendant by your side can dramatically impact the outcome of a birth. Following a visit to Central America, again with care, and while I was about 7 months pregnant with my second child, I began to follow the issue very closely. I learned that 15% of all pregnancies result in some form of a life-threatening complication. A recent study estimated that roughly 1,000 women die every day, making reproductive health problems the leading cause of death worldwide among women ages 15 to 44. In sub-Saharan Africa, for example, 1 in 22 women die in childbirth, but in developed countries, it's 1 in 7,300. In addition to these statistics of mortality, for every woman who dies in childbirth, another 20 to 30 will suffer debilitating complications. This translates to 10 million women debilitated every year just through pregnancy and childbirth. The hopeful news in all this is that for all those complications, experts estimate almost all of the deaths are preventable, 90%. In the film, I tried to put a human face on the women who face these complications, but also the barriers they face in accessing the care they need. They can lack human resources, so that there is a skilled attendant in the event that the complication arises and a plan of what to do when and if it does. We're not even talking just doctors or nurses here, but qualified, trained caregivers that are culturally appropriate and sensitive. Then, those skilled providers need basic supplies, a clean place to deliver, basic medications that can stop hemorrhaging, for example. Oftentimes, transport or communication is the biggest barrier, and women need to be able to reach skilled attendants. Finally, we need to inform the populations we're trying to serve about the benefits of utilizing these resources and of seeking care in a timely fashion. We need to assure them that those facilities will treat them with dignity and respect. These inputs themselves aren't highly technical. We need new research and new tools in the field of maternal health, but largely we need to deliver proven, cost-efficient solutions to more communities. We need to invest in the lives of mothers, of every mother, and thereby preserve the caretakers, the engines of economic growth, the role models, and the leaders of tomorrow's world. And it boggles my mind that we haven't done this yet. But these are still just statistics. This is not an issue about numbers and technical terms. It's about women. It's about caretakers and leaders. It's about creative thinkers and teachers. It's about mothers. Once I learned the facts, I knew I had to find the faces behind the statistics. I set out to see for myself who the women are and to do something about it. The result of that search was this film. Since I became entrenched in this issue, I've witnessed nothing but progress with each year. In fact, in places where political will and resources have been invested, progress has been made, even in the most difficult of environments. In 2007, I traveled to Peru to visit the FEMI Project, a highly successful partnership in the highlands where maternal mortality rates decreased by 50% in less than 5 years. On this trip, I learned that so many solutions to this problem are low-tech, and how when NGOs, universities, private sector, and local government come together, success is possible. In Afghanistan, the country with the highest maternal mortality rates, the health ministry has managed to double the number of midwives available to help deliver safely. I visited Ethiopia for the first time last September, and they have had an incredible success training 30,000 plus health extension workers and distributed them around the country to provide needed support in remote areas. So we are making progress, and the number of annual deaths has continued to decline in many parts of the world. In the last 5 years, the official estimates have been altered from 500,000 deaths per year to 330, 40. The numbers are still a little, and we are changing the statistic in the front of the film for the television broadcast, just so you know. Some of that may be better accounting, but much of it reflects working investments. In the development world, it's always reassuring to see investments with such amazing returns. What we cannot allow is that the positive trend line to breed complacency. 343,000 is still 343,000 too many. So as those of us watching closely count the gross sums, it is critical to remember that each life as a mother, a sister, a daughter, and a friend. Every mother counts. And so that's why I stand here today. No Woman, No Cry is a result of a very profound discovery process I have gone through and continue to go through today. I'm fortunate enough to meet so many inspiring women and healthcare providers on my travels. The faces behind the statistics are the faces I see when I contemplate the numbers, percentages, and other statistics on maternal health. Now, firmly planted in my consciousness, I cannot help but act. And I believe others will feel compelled to do the same when they learn the facts and see the faces and hear the stories for the first time. That's the main goal of the Every Mother Counts campaign. The global community has come a long way, and thanks to the tireless efforts of some real champions, this issue is finally on the radar screen. World leaders talked of its importance in 2010 during the discussions of the MDGs as a whole, and the need to invest in critical interventions, such as those that can impact maternal health. But much more must be done, which means that policymakers in the developed and developing world need to continue to invest in these cost-effective, proven interventions. And what's more, the public has to demand that they do so. Each one of us has a role to play: the media, policymakers, civil society, and private sector. We know how to prevent these senseless deaths, but what is still missing is a united voice that refuses to be silenced until all women have access to the care they need. Challenge yourself to bring this issue home and imagine yourself, your loved one, suffering a complication with no access to care. Learn about the solutions and the strategies that work. Join us at everymothercounts.org and let us help you on that journey. Tell your friends, your book club, your mom's group, your church, and speak out. Make sure that your elected officials know that this is a priority for you. Make sure they know what we can do if we put our minds to it. There are some amazing groups scaling up access to the tools, human resources, and access to services needed. There are several ways to get yourself and your community involved in a meaningful way. Every Mother Counts is intended to be a partner in helping you on that journey, and we're especially focused on making a big push this Mother's Day. So encourage you to be a part of our community by taking just one action this Mother's Day to signal that you care. Invite your friends over to watch the film when it airs on OWN on May 7th and talk with them about maybe taking an action together. Check out the CD we're launching next month with our friends at Starbucks, or check out some of the tangible actions you can take. Collect cell phones, support a midwife in training. We want to give you the information you need to stay informed and the opportunities you want to get involved. This is a uniquely universal issue. Every mother counts, and that includes you. Thank you.